Hello, everyone. It's Dr. Tam here, your pain specialist in Vacaville, California, where every single day I want to give you tips on not just how to decrease pain, but also increase your function and also your longevity. A lot of people have seen that I've just written my first book that is now out on Amazon. I have copies at the office that is on its way. It should be coming this week, earlier next week. I am super excited about that. One of the patients that already bought the book and was telling me about how they were reading it and they looked up the sugar connection between the body and health. So, the book is titled The Truth About Chronic Pain, What Your Primary Care Doctors Did Not Tell You, right? And it's that connection between sugar and health. See, most of us know when you look at your blood work, okay, maybe cholesterol, you look at sugar levels for diabetes, right? You look at the fat content, triglycerides, how's your heart doing, liver enzymes, but no one really makes that connection on what is the true connection between sugar and your health. Now, we all know sugar is bad for our health, right? Everyone knows that. You talk to kids and they know sugar is not good for you. Oh, I've been told not to drink soda, different things. But what we don't know is what too much sugar actually does to you, right? See, diabetes, when you look at a diabetes as a whole, we know that too much sugar equals diabetes. But how does that actually work? So I want to share with you today a overview of what sugar actually does in the body, okay? Especially table sugar. See, table sugar is mainly fructose. And if you think that fructose can be actually processed by the muscles in the body when you drink sweets, well, fructose, here's the thing. Fructose can only be processed by the liver. And if you have too much sugar, you're going to end up with a fatty liver because unless if you are burning off that fructose, okay, and you're actually utilizing it, your body actually stores it, and it stores it in the liver first, and then eventually it stores it as fat actually. So that's how we end up with a fatty liver, right? So if you end up with a fatty liver, now you're not able to process a lot of other fatty foods correctly. Your gallbladder is not going to work correctly, and you will end up with stomach problems, which can include bloating, irritation, irritable bowel syndrome, right? So sugar really has a huge effect on the liver itself. Now, here's the other thing. We take care of a lot of people with neuropathy in our office. Well, you might ask, well, I don't have diabetes, so I shouldn't get neuropathy. How wrong is that? Because a lot of times, half the time actually, the patients that come in with neuropathy don't even have full-blown diabetes, right? Now, understand the liver is one of those organs that follows the lineage of genetics. Like if, for example, what does that mean? If your mom or dad had liver problems or liver disease, cirrhosis, they didn't take great care of their body, as a child, you are more likely to have liver problems. The liver is one of those organs that will follow one after another, generation after generation. There was a book written by another doctor called the liver, I can't remember, it's like the liver disease, or it's called the liver rescue, I believe. It could be called liver rescue, where he shows, why the liver could be like that. So a shout out to that book, Liver Rescue. So ultimately, if you don't take good care of your liver, now your kids will suffer from a poor functioning liver, and then your grandchildren, it affects multiple generations down the line. So that's one of the most important things to take care of, is to understand is, you know what, you're not just keeping yourself healthy for you, you're keeping yourself healthy for generations to come, right? So going back to the neuropathy and the sugar, too much sugar in the body, right? It's toxic. It's toxic to your body. It's toxic to the blood vessels, right? Think of sugar like acid eating away at your plumbing. What's it going to do? Well, that's going to cause blood flow problems. Your blood vessels won't be able to contract and expand the same way. Not enough blood will be flowing through it. You're going to have a lot of thickening of the walls or scarring of the walls. So blood flow is not going to be good. But where does it start affecting you first? It starts affecting you first furthest away from your heart, which is your toes and also your fingertips. That's where it starts affecting you the most, is in those areas. So when you look at people who have diabetes or people who are just pre-diabetic, most people will start noticing that they start getting a little bit of swelling, right, in the feet and their toes. They might start getting some tingling and numbness in their toes as well that they never had before, right? So a lot of times, if you have numbness in your feet, you have to differentiate. Is it the neuropathy, poor circulation causing that problem? Or is it a pinched nerve in your back? And not all the time are you able to differentiate it, right off the bat. What we do in the office is we do a very specific test to test whether or not you have neuropathy, and then we also take an x-ray to see if the lower back has pinched nerves as well. Then from there, now we're going to know exactly where the problem is coming in from, right? So the chance of someone having some form of neuropathy when they actually have diabetes is actually just between 70 and 80%, which means if you're diabetic, if you're definitely full-blown diabetic, your chance of getting neuropathy is really, really high, right? It's like 7 to 8 out of 10 people will get some form of that, So that is really a big sugar problem. That's the sugar connection. Now, a lot of you might have heard of leaky gut syndrome, right? So besides leaky gut, now there is something new, newish within the last few years, called the leaky brain. Now, what does that mean? That means that leaky gut toxins can leak out into the lining, into your bloodstream. And now all the toxins now will get to break through the blood-brain barrier, because with too much sugar, the brain barrier, instead of being solid and keeping everything out and keeping all the toxins out, it actually starts opening, and now toxins can actually start leaking in, which is really, really bad for you. And Alzheimer's, dementia, some specialists are calling it diabetes type 3, because early onset of dementia and diabetes, or early onset of dementia and Alzheimer's, is building up of plaque in the brain, and it's causing the toxic overall, the toxins getting to the brain overall. So that's another thing on sugar that you have to worry about. So besides creating problems with your organs, creating problems with numbness and neuropathy, now it's going to cause mental problems as well. So, with all of that, it is best to stay away from sugars. Well, you might say, well, Dr. Tam, I thought we need carbs. Yeah, we need some carbs, but a lot of your carbs should be from vegetables, right? Complex carbs, not straight from sugar, because that is pretty much fructose, and it's not so much glucose that your body can use. Okay, so I hope this sheds some light onto how sugar can really affect your body. And when you get a chance, look online, check out Amazon. The Truth About Chronic Pain. That's the book. That's what I've written, and it talks about that. Talks about a lot of other good content in there about chronic pain overall and what it can cause. All right. Until next time, I'll talk to you guys soon.